For clinicians at HHS, does the implementation of a patient portal result in increased patient and physician satisfaction as compared to a hospital setting that does not have a patient portal? To find out, let's look at a unique story. Meet Sally. Sally is a 34-year-old single mother from London, Ontario. Recently, she moved to Hamilton, Ontario with her 5-year-old daughter, Lucy. Lucy has a history of chronic asthma and has to see a pediatrician at regular intervals. One day, Sally takes Lucy to visit a new pediatrician. Anxious, Lucy insists on seeing their old pediatrician in London, Ontario, but Sally tells her that since they have moved to Hamilton, Ontario, they need to see a new doctor closer to home. Sally and Lucy arrive promptly at the pediatrician's clinic. They walk up to the receptionist, who tells them that there will be a long wait time before seeing the doctor. She tells Sally that she will have to fill out an intake form as she waits as well. Sally then asks the receptionist if the clinic uses patient portals. The receptionist says no, and informs Sally that the doctor does not like using them. Shocked, Sally asks why not. They're an incredibly useful tool. The receptionist tells Sally that the doctor thinks patient portals would increase his workload by having him to discuss his notes with patients, and worries that his notes might upset or frighten patients, leading to patient anxiety. The receptionist then points to the waiting room full of patients and tells her that the doctor does not have the capacity to increase his workload right now. Disappointed, Sally nods and sits down with Lucy in the waiting area. Lucy then asks Sally if she can go play with the other children in the play area of the clinic, and Sally says yes. While she waits, Sally takes out her smartphone and decides to look at her own patient portal linked to her psychiatrist's office in London, Ontario. She immediately sees a notification. The clinician's notes from her last meeting are now available to view online. Sally then sinks back into her chair and thinks to herself how easy it is for one to use patient portals. She then proceeds to review her psychiatrist's online notes. She notices an interesting point. There seems to be a discrepancy with what she had described at her last meeting and what the psychiatrist had documented on her notes. Sally makes a note to bring this up at her next meeting with her new psychiatrist in Hamilton, Ontario, in case it changes the trajectory of her care. Sally also notices that there are resources for her to use to focus on her care outside of the office. Sally then looks around at the waiting room and wonders of all the opportunities the patients at this pediatrician's office are missing out on. Poor kids, she thinks, missing out on amazing resources for better care. Sally does a bit of searching on her smartphone and sees there's a screening questionnaire from her new psychiatrist in Hamilton, Ontario, who uses a similar portal to her old psychiatrist in London, Ontario. Sally decides to complete this questionnaire as she waits. After all, it'll speed up the process at her next visit. After a long wait, the pediatrician invites Lucy and Sally into his office. The pediatrician asks Lucy and Sally routine questions that Sally believes would have already been answered in the pre-visiting questionnaire on the intake form. At the end of their visit, the doctor gives Sally paper copies of resources for Lucy about asthma control. Sally complains that she already had more information that was constantly updated on Lucy's patient portal connected to her old pediatrician. Sally and Lucy thank the doctor for his time and then head back home. At the end of the day, the doctor sits back and reflects on his patient experiences from the past week. Sally had been the third person to inquire about patient portals. The first patient had wanted to use the secure messaging feature of patient portals because they were tired of calling and missing the doctor. The second patient wanted to update their appointments electronically. Maybe it was time the doctor looked more into using patient portals himself. So, the doctor fired up his tablet and decided to do some background review on patient portals. He found that he wasn't alone in his concerns about joining a patient portal. He found that many doctors in the medical field felt that patient portals would be too expensive to implement. Patient portals would add to existing workload by having doctors to deal with increased phone calls, emails, and office visits. Patient portals would be challenging to use for physicians with poor documenting skills. Patient portals would not be understood properly by patients. And patient portals would increase a doctor's chances of getting sued for malpractice. However, the doctor quickly learned that many of these concerns were unfounded. Studies found that patient portals on average turned out to be significantly cheaper than clinicians had anticipated. Studies found that patient portals did not result in increased physician workload through increased patient contact attempts. Studies found that patient portals drove better documentation skills, enhancing communications between clinicians. Studies found that 85 to 90% of patients stated that they could understand their patient notes on patient portals. Studies found that patient portals could prevent outcomes leading to malpractice by making it easier for administration to see and track errors. Patient portals now seem like a far more convincing option for the doctor to use in his own practice, but the doctor was still curious to know how patient portals affected the specialty of pediatrics specifically. Through literature review, the doctor learned that there is a high demand among adolescents and teenagers to have online access to their health records and have the ability to make their own appointments electronically. Also, the doctor found that patient portals with secure messaging allow teenagers to more easily engage in uncomfortable discussions with their clinicians about health issues. The doctor recalled that his last patient, Sally, had mentioned a patient portal linked to her new psychiatrist in Hamilton, Ontario, so he proceeded to do some research into the use of patient portals in the field of mental health. The doctor was astounded to learn that the demand for mental health services was rapidly growing, and that emerging studies were pointing to the use of e-health solutions to transform healthcare services to better care for mental health patients. The doctor also learned that the use of patient portals was demonstrated to improve access and effectiveness of preventative mental health care services, improve record management for providers and patients, and help providers with clinical decision-making. Finally convinced on the idea of integrating patient portals into his own practice, the doctor proceeded to do some research into tactics for successful patient portal implementations. He found the following recommendations. 1. Make sure documentation is written in a way that is sensitive to the patient, while not omitting anything that is important to the patient's care. Approach case by case. 2. When documenting, be factual and objective. Describe what you observe and avoid adding your own interpretation. Be sure to also include the patient's perspective and reasons. Do not include bias, blame, value judgments, and discriminatory comments. Avoid easily misunderstood or misinterpreted abbreviations. 3. Have an automated reply when using direct messaging that states when to expect a reply by. Patients gain value by not getting any expectations of when a reply is due by. 4. Spend time educating physicians, nurses, and any other providers that utilize patient portals on all features in the patient portals. 5. Rely on user feedback prior to modifications of any patient portal. Greater success in patient adoption and use is linked with being able to make timely, evidence-based recommendations. 6. Having clear guidelines about what should be communicated via secure messaging versus in person matters, and it is important to address what is urgent enough to seek emergency care for. 7. For pediatrics, create separate accounts that are linked to parent-guardian-child relationships. These profiles should offer hide options where clinicians can determine what is shared with the parent or child. 8. For pediatrics, have a general outline of what information is provided to the parent and what sensitive information will be hidden automatically, such as sexual health concerns. 9. For the field of mental health, have volunteers or other staff help patients learn to use patient portals. Provide computers or kiosks in the clinic for patients to use as they wait. Provide regular reminders or instructions on using patient portals, such as flyers or cards. If there are screening questions, make them relevant to the parent's needs. Indicate where it is better to speak to the provider as opposed to communicating through the patient portal. 10. To increase the provider uptake in the mental health field, train the providers on patient portals so that they can use them effectively and integrate efficiently into their workflow. Indicate that the patient portals have been proven to reduce workload, improve efficiency, create automated summary reports, and produce screening questions that the patient can directly answer on the patient portal, which will save physicians time. Indicate that patient portals improve patient activation, recovery scores, and organizational efficiencies because patient adherence to medication improves, providers' errors are reduced, patient perception of care quality increases, and patients feel an increased control in the trajectory of their care. Indicate that the patients with access to their clinical notes reported feeling more informed, satisfied, engaged, and adherent to care. Now, the doctor is ready to become a champion for patient portals and help in the adoption process for patient portals in his organization as well. Thank you for watching.